This next portion of our training really kind of dives into some of the things that we talked about at the outset, um, in looking at understanding some of the complexities. And I want to go to the next slide and have folks think through, kind of on the heels of our role play, if you could think about, and maybe put something in the chat if you're willing, or just reflect for a minute to help frame and think about some of the comments that I'm going to have in our next, last leg of our training here. So think about a child or youth with complex needs that you either know, care for, maybe your child, relative. You might have been, responded to an emergency if you're an emergency first responder, anywhere that you may be seen in your clinical work or personal life. So think about what best describes an emergency or disaster situation for that child with complex needs, and what new challenges or opportunity did that child, youth, or their family face in that scenario. And if you could kind of hold that close um, in your mind and sort of have that be sort of the lens, that experience for that family or child. And if you want to put something in the chat, we're welcome to love to see that. And if you want to just kind of keep that, that's fine too. And I'm gonna, as people are kind of reflecting on that, I'm gonna kind of move ahead and share with you, um, some reflections from families that we've had. So, as I mentioned earlier at the outset when I kicked this off, one of the things that we really felt, and some of the work that we're doing now, is really hearing from and working with families across the Commonwealth. And so these in-home assessments that we're doing across PA, with the partners that are here today, we heard a lot, as we've been doing this work over the last couple of years, in doing in-depth interviews and hearing from families in real time about what some of the challenges, and some of the opportunities have been particularly during the pandemic. And I wanted to share some of those with you because in many ways, this pandemic has kind of set us up for an emergency and a disaster, right? It's this pandemic that we're still in the midst of. And so some of the things that a lot of our families have shared during this time have been, that just the challenges of virtual schooling, what it's been like to actually, have disruption in services. For many of our children, they get their physical therapy or speech therapy in school. So when we pivoted to virtual, some of those services were interrupted. Individualized education programs were, not able to be as easily implemented in the virtual environment. Certainly home nursing was greatly affected for families that were living at home, either no home nursing. Many families were required to be on 24/7, which, as I always say, is something we would never do in the hospital setting. The large financial impacts that really, affected families, whether that was loss of jobs, income. Many of us have known or had someone in our immediate family or friend group that died or suffered morbidity from COVID. Thinking about routines. So thinking about, for many of our children and our youth and our, that might, let's say, have a diagnosis or a condition that really, requires some routine. Those disruptions have been hard. Prolonged isolation, the social distancing and the use of PPE for some of our children has really been, challenging. Communicating and explaining risk and the limited ability for that. For many of our children and youth, where these maybe our typical routine was disrupted, there were new regressive behaviors that sometimes arose for families in a situation where they now have limited supports, and delaying healthcare. And these were all real things from actual families in Pennsylvania. One of the things that we just wanted to kind of help frame for our team here and in the training is kind of thinking about children with complex needs and opportunities for partnerships. So on the next slide, as you can tell, our team and a love of ours is Kermit. So I want you to think for a minute. I often think in my world, for the 20 years or so that I've been doing this, there's children and scenarios, and I hold them close in my heart and my mind, and sort of just the scenarios and the realness of families and children are what resonate with me. So I'm often putting things in real life context. So bear with me on that. So think of a 10-year-old named Kermit, who has a diagnosis of cerebral palsy, and he has a wheelchair. So he needs assistance with walking, has mild conductive hearing loss, needs a feeding tube, has home nursing for overnight feeds, and he lives in Venango County, which you can see there in the map. So go to the next slide. So when I think about Kermit, think about, as I think about all of his needs, I think about his medical home, his community, his neighborhood. So he, has a need for equipment, school, he has a medical home, I mentioned he has a requirement for home nursing with his, being dependent on a wheelchair. He has therapies that he needs to maintain his functioning. He might have behavioral health supports, and certainly he has a family and a need for recreation. So keep that in mind, the members of the community and neighborhood that he needs to kind of think through. And go to the next slide. And so when I think about children with medical complexity, one of the things that I want to frame for all of us is that when we think about, if we think about, Pennsylvania, we have 12 million folks that live in our Commonwealth. And so we think about all the children that live in Pennsylvania, but 19% of those are children that have a special health care need, according to the HRSA federal definition. When we think about a child like Kermit, that really meets that child with medical complexity, that is about 0.4 or 1% of all children. So it's a small percentage. And if you look at my pyramid here, it's the top of that pyramid, but those are children that often are most vulnerable. And that's kind of one of our big messages today in this disasters and emergencies. The stakes are highest for everyone, but most for those children. And so their technology needs put them at risk during emergencies. And the next slide. So one of the things that's really important is just this idea about emergency preparedness versus emergency response. And to me, as someone that really thinks about public health in the medical world, I often think about, a lot of our teaching is about this upstream and downstream. And so this idea that if we're prepared in emergency and these role plays and the things we're talking about today, that's kind of that upstream, right? So you're kind of getting ahead of it, you're prepared, you have that go bag, thinking about some of the things we've done already in this training. And that emergency response, is going to be a lot better if you're more prepared. And so that's a really important thing, for us to be thinking about in this training and how we look at this. And you can go to the next slide. So this is really, as I mentioned, that emergency preparedness is what we're doing before the emergency. We're planning, there's communication, which came up in our role plays, there's training, we're doing drills and exercises. I mean, today is just the tip of the iceberg for training, but ensuring things like, and we'll talk about the go bag that Jacqueline mentioned in the chat, and supplies, so they're available. So that emergency response, those actions after the emergency or disaster, if we're prepared, we're minimizing those effects. And so that's where in that response, we have those communications, we're coordinating with our first responders, you're seeking medical care, you might be sheltering in place or seeking shelter if that's a need, and you're getting those supplies and equipment for those that are affected. So the next slide, I just wanted to share a colleague of mine, Tom Hipper and Dr. Chernak, who have been such mentors to me in this space, did a really great scoping review where they sort of talked about, the support that families, when you look at the literature, really talking about this, individual level emergency versus disasters, and families really talk about needing information and education and training around a lot of the things that we're going to touch on today. This care plan, connecting to their first responders, looking at communication boards and other tools, and looking at, their child's needs. We talked about that, and that's sort of some of the simulations, right? Their child has maybe dependence on technology, maybe they have some physical disabilities and intellectual disabilities, but one-on-one is best for working with families. And in the literature, healthcare providers were thought to be the most trusted source of information from the family perspective.